There's a growing conversation about former CDC Director Susan Monarez's testimony yesterday at a Senate hearing. She discussed her departure from the Atlanta-based agency and her warnings about political interference in vaccine policy. Monarez's testimony described how such influence undermines the CDC's ability to respond to outbreaks, how she says it threatens public trust and has left the agency weakened by vacancies and safety concerns.
On August 25th, I could have stayed silent, agreed to the demands, and no one would have known. What the public would have seen were scientists dismissed without cause and vaccine protections quietly eroded, all under the authority of a Senate-confirmed director with unimpeachable credentials. I could have kept the office, the title, but I would have lost the one thing that cannot be replaced: my integrity.
That moment really highlights a bigger fight. Can the CDC keep science above politics? Time to discuss this with Professor Stephen Patrick, the chair of Emory's Department of Health Policy and Management. He's also a former senior policy advisor for the White House Office of National Drug Control Policy. Welcome to the show.
Great to be here.
First of all, can you just share your overall take on the hearing?
Well, it was an extraordinary day, and I do think as we're thinking about how the CDC can be effective in talking about vaccines and protecting the public, what we heard yesterday were certainly reasons to be concerned about recommendations that may be coming out even just this week.
From your perspective here in Atlanta, a community that watched a shooting happen targeting the CDC campus, those employees going back and having feelings about that, then there's more turmoil. How does this all affect the morale among career scientists and staff, not just at the CDC, but maybe overall?
Yeah, I think that is worrisome. You know, these are public servants and scientists who work to make people healthier. And, you know, most of these are not political people. And as we, see this erosion of science in CDC and beyond, I do worry about the signals that sends to existing public servants and people who would be public servants. So I do think that's worrisome as well.
Former Director Monarez told senators she was fired because she refused political directives tied to vaccine policy from Secretary Kennedy. Talk about the implications for the CDC's credibility when scientific recommendations risk maybe an override. This is a highly emotional conversation happening out in communities right now.
It is. We polled Americans, a sample of, a representative sample of Americans, what they thought of the recent change to ACIP. This is the committee where vaccines are reviewed, the science is discussed. That's what most of the hearing was about yesterday. We asked the public, what do you think about the recent changes where essentially all the people on ACIP were fired and replaced by different folks, and many of those are vaccine skeptics. What we heard from Americans was about half of them would find ACIP's findings less credible. That's worrisome. And as we walk through this, I'm also a pediatrician. And as I think about how I make recommendations to families, where do I rely on information? I am worried about what's going to come out of ACIP today and tomorrow. I am mindful that there are large organizations like the American Academy of Pediatrics who always make recommendations on vaccines. That's where I'm going to be looking towards a steadying force, because I'm not sure what's going to come out of ACIP this week.
What do you feel is the single most important step for families to consider as they are trying to navigate a kind of a crush of information and make choices that are best for the people they love?
Talk to your pediatrician. I think that's the best advice I can give. We heard in the hearing yesterday really compelling story from Senator Cassidy, who chairs the Health Committee. He is also a hepatologist. So one of the things where he gave a pretty compelling story about why hepatitis B vaccine makes a big difference for newborns. Those are the patients I care for. So having that individual conversation with your pediatrician or your child's doctor is really important. They are the ones who can help you interpret all the things that are coming in. Parents have so many things coming at them right now. Social media, talking about vaccines, that's been a problem for a while. But now we have unclear guidance coming from CDC, and that's really unprecedented. So have that conversation with your child's doctor.
All right, well, your information is so helpful. We appreciate the time. Thanks so much.